Dr. Clancy, you are now recognized for 5 minutes.
Thank you. Good afternoon, Chairman Kaufman, Ranking Member Custer, members of the subcommittee, Representative Denham. I'm accompanied today by Dr. Stephen Hunt, Director of our Post-Deployment Integrated Care Initiative. As Deputy Undersecretary for Organizational Excellence and an internist, my background has been conducting and supporting research to improve patient care and inform public policy for much of my career. So I know how important it is to get the science right and assure you that VA is taking every step possible to advance research, clinical care, and education on Gulf War illness. Since our last hearing in 2013, VA has funded or conducted over 60 studies. Funding for Gulf War research has increased steadily from $5.6 million in 2011 to over $14 million this year, and that's a very conservative estimate. For example, a study funded this past June is a randomized trial of something called CoQ10, thought to change subcellular function in a way that could help treat the effects of Gulf War illness. Other studies evaluate the effectiveness of a broad range of treatments for musculoskeletal pain, fatigue, and cognitive issues using exercise programs, magnetic stimulation, and other innovative approaches. So as we look for promising interventions through research, VA is also working diligently to treat those veterans that are now suffering from Gulf War illness. From 2000 to 2015, the percentage of Gulf War veterans enrolled in our system has increased from 13% to about 33%. We offer continuing evaluation and treatment to the over 700,000 men and women who served in Operations Desert Shield and Desert Storm. We have centers of excellence, 3 of them called War-Related Injury and Illness Study Centers, or RISCs, and we want to express our appreciation to the Congress for these, which are charged with conducting cutting-edge research, clinical education, and providing specialized care for Gulf War veterans with complex, chronic, unexplained, or very difficult to diagnose conditions. And demand for their services, no surprise, as the number of Gulf War veterans has increased, demand for these services has also increased. In addition, a total of 145,000 Gulf War veterans have undergone a Gulf War registry exam, allowing their health concerns to be evaluated by VA physicians and enabling them to be referred for additional care. We first learned from Gulf War veterans just how important it is to integrate all the care and services that veterans need, and to integrate and organize that around the veteran and the veteran's needs. And in fact, that became an organizing principle for much of our system and team-based primary care. And in fact, that has helped us to organize our referrals to community providers when necessary as well. We know that many Gulf War veterans are affected by a debilitating cluster of medically unexplained chronic symptoms that can include fatigue, headaches, joint pain, indigestion, insomnia, dizziness, respiratory disease, memory problems. And the chronic multi-symptom illness we see so often in Gulf War veterans is clearly not a psychological condition, so I want to be very clear on that. We're committed to ensuring our research, clinical care, and education takes into account all of the factors that are relevant to returning that veteran to the highest level of function. We have aggressively pursued and fast-tracked studies in ways we can meet the research and treatment needs for all veterans that have been affected by environmental exposures. So that research serves 2 purposes. One is to improve clinical care that we're providing now for those enrolled in our system, and the other is as the basis for presumptions or other benefits. Our philosophy has been to come down on the side of the veteran when the science supports it, and as you've seen, we have made our policies more liberal for C-123 crews and are now adding new presumptives for veterans who served at Camp Lejeune. In addition, we've been working with Ron Brown at the National Gulf War Resource Center to address a number of concerns and possible presumptions for Gulf War veterans. Going forward, we recognize that while we've learned a lot, we need and value the ongoing feedback and input from our stakeholders, this committee, of course, the Research Advisory Committee, the Veteran Service Organizations, and very importantly, Gulf War veterans themselves. As we conduct an in-depth review of the most recent Institute of Medicine report, we're going to include 2 full days to receive public comments and feedback from our stakeholders and partners to assure that VA's priorities are informed by veterans and stakeholders. You know, vigorous disagreements in science are part of the landscape, and we welcome that at all times. That's what moves science forward, and we're committed to hearing from all sides. That concludes my testimony. My colleague and I look forward to answering your questions and that you or the committee may have.
Thank you, Dr. Clancy.